Hello and welcome. This is the first lesson of our introduction to ABA. These topics I'm going to go through fairly quickly. Some are part of the task list and some are not, but they're important information for you to know to understand the theoretical background of ABA. If you want to know more, I highly encourage reading, doing the activities on the lesson pages, and doing some research yourself. There's lots of good YouTube videos about each one of these that you could go and access. So, what is behavior analyst? It's a scientific study of behavior. So it focuses on how the behavior interacts with the environment, and it's rooted in behaviorism. So emphasized observable and measurable behaviors. And we have four main branches of it. I just like giving a little bit of history. Prior to behaviorism, a lot of psychology was in this Freud phase. A lot of what Freud thought was that your behavior in the present moment was influenced by your history, as in your childhood. You could look at an adult engaging in some sort of maladaptive behavior. Let's say they're so depressed they're not leaving the house. They can't leave the house, they can't go grocery shopping, they can't hold down a job because they're just so depressed. And if you look at their childhood, you could determine why that happened. And working through those childhood experiences could fix the person. That's really where a lot of Freud's theories were built upon. Behaviorism came along and said, well, wait a minute, we could just observe their behavior right now, and then we could change the contingencies of the environment and change the antecedents, the things that come before. We could change the environment and their behavior would change. No one's saying that your childhood doesn't influence your behavior, but diving into it, talking about it, it would take so long to figure out exactly what was wrong, talk through it, and it doesn't always work. But modifying the environment does often works a lot faster and has more efficacy. That's where behaviorism kind of shot off from what was going on in psychology and created its own field. Behaviorism is our philosophical foundation of ABA. It's focused on determinism and empiricism, and it was introduced by John Watson in the late 1800s and developed by B.F. Skinner through radical behaviorism, which emphasizes that behavior is shaped by reinforcement and punishment rather than thoughts and emotions. So that's our first branch, is behaviorism. It's all the theories that our practice is built on, and all those basic psychological principles that those early founders discovered. If you were to continue to a master's degree, you would learn more about that. The experimental analysis of behavior is the research behind ABA. Sometimes it's done with humans, but it's often done with animals. It focuses on very controlled experiments to study the basic principles of behavior. So all of Skinner's pigeon experiments, the rat experiments, that's all experimental analysis of behavior. So it's always done in a laboratory, so you can control all the settings or all the things that are going on. And it focuses on simple behavioral processes, like, can I get a pigeon to press a lever more often if I increase their reinforcement? So they could find out how different reinforcement schedules affect a rat pressing a lever in a controlled setting. It provides a foundational understanding of how behavior is influenced by experimental factors. And then we use those basic principles to create the therapy that you would do in a home with a child. And that is not very controlled. There's lots of variables going on. In this controlled setting, we determine if these principles work or not. It's the theoretical grounding for all the things we do. This is how we came up with it in these very controlled settings. So ABA is when you take those very controlled experiments and those principles and attempt to utilize them in the real world with real people, with where it's not as clean and nice. So ABA, it's been shown very effective with autism. We really focus on measurable outcomes. It focuses on improving communication. And we create really individualized intervention plans with ABA to create behavior change. And then the fourth is, we call it the professional practice, but it's the service delivery. So it's direct application of those principles in everyday settings. And we do this with professionals like teachers, parents, behavior techs, all do use this professional practice. And it is though I'm saying there's 4 branches and ABA is one. And so going back to that ABA, a lot of that is the research behind whether we should use this. So when someone takes those very controlled principles and they try them in a research setting in like a school, in like a home, and then if it's found effective, it goes to professional practice. Professional practice has nothing to do with research. It's only about creating positive outcomes for clients. And so it's done in the clinical, educational, workplace settings, and they always would have an intervention plan. When a teacher uses positive reinforcement to encourage students to complete an assignment on time, this would be professional practice. It's hard to find many examples in education or even workplace that aren't using a little bit of ABA. We just use it everywhere. I've never been to like one of my kids' friends' house and they're not like using a little bit of it. So if you're going to use reinforcement, if you're going to modify the environment to get, someone to behave in a certain way, dog trainers are using it constantly. Workplaces use it all the time. For, hey, if you meet your quota, you'll get a bonus. Or if you meet your quota, we'll have Friday parties or whatnot. All that is based on those principles that first we started with that theoretical foundation where people thought about it, the behaviorism, and said, well, that seems like it would work. When I look around the world, this is how this is working. Then someone took it into a laboratory with some rats and pigeons and occasionally people. They did very controlled lab testing of it and they said, look, it works with the rats. And then someone took it to a school or a home and did an experiment to make sure it works with a child or with a person. And they said, yes, it works. And then we pulled it into our professional practice and we started utilizing it to create behavior change. So these are the 4 branches. One, the behaviorism is that philosophical foundation, and it's like looking at reinforcement, thinking about it, punishment as behavioral principles. No one really tested them in a controlled setting. It's just they were thinking about it and coming up with theories. And then you have experimental analysis of behavior, and this was very controlled in the lab. Studying reinforcement schedules in animals would be an example. And then you have ABA, and you look and you see if you can take some of those principles you got in EAB and see if you can change socially significant behaviors in less controlled settings. So like teaching a child with autism communication skills, and then behavior service delivery. So you take all that worked. If the research was showing that things don't work, you wouldn't then pull it into behavioral service delivery, and you see if you can use it in real world settings. So here are some key takeaways. You'll have the slide, but you can see how we utilize those 4 branches. Okay, thank you, and I'll see you next video.